So, yeah, Dr. Karina.
Let us begin the session by giving a salutation to the Almighty. अपने हाथ जोड़िए सामने, अपने चेस्ट के सामने. आप अपने भगवान को अपने मन पे रखिए. हम चैन करेंगे. ओम सहना सहनौ पुनक्तु सह वीर्यं करवावहै तेजस्विनावधीतमस्तु मा विद्विषावहै. ओम शांति शांति शांति. Greetings all from the Ghayuk Enterprises. Today we are gathered in this platform for our second session of Integrative Medicine for All 2021. Following our launch of the online support program, Dirghayu COVID Kavach, we have today with us Dr. Nivedita Goswami, Managing Trustee, KGMT Multi-Speciality Hospital, Dr. Kavita, Assistant Physician of Kottakkal Aryaveda Shala Arnakulam branch, and Dr. Amit Mishra, CMO Dirghayuk Treatment Center, Mumbai. I welcome all the respected dignitaries on behalf of Vivekananda Health Global and Dirghayuk Enterprises to our second session of Integrative Medicine for All 2021. With seeing the significant increase in the number of youngsters and children getting infected in this second wave as compared to the first wave we had last year, we are keeping the topic of today's session as positive health for children during COVID. First, I would like to request Dr. Amit sir to give us an explanation about a brief explanation about today's webinar, sir. Over to you, sir.
Okay. Basically, what we have seen is the number of cases has been on rise, and we have so many experienced doctors with us. So the idea is to pass on the message, the education, the awareness to the general people, so that they will be confident in undergoing all these changes which is happening in the society. So this was the main theme why we have started with this particular program. And then we have the Dirghayu COVID Kavach. Dirghayu COVID Kavach is an online support program in which people who would like to have the prevention or who are suffering from the COVID, they may be in the quarantine or isolation or in the hospital, or they will be the third phase of post-COVID rehab. So in all these phases, we will be providing the online support with the Ayurvedic medicines and the yoga teaching with the online support. This is for 14 days. And we will be also doing certain kind of measurements through the certain kind of stress scales which we have, so that we can measure the pre and post changes. तो लोगों में ये कॉन्फिडेंस लेके आने के लिए कि हमने ये दीर्घायु कोविड बनाया है. So over to you, Dr. Karina.
Sorry, sir. Thank you, sir, for the brief introduction. Now I would like to introduce Dr. Nivedita Goswami, MBBS, MD Pediatrics, Managing Trustee of KGMT Multi-Speciality Hospital, Chief Pediatrician and a Neonatology Consultant. Ma'am is a distinguished pediatrician of Guwahati with an experience of over 20 years. Ma'am has an experience at the East and Nursing Home Guwahati as a consultant pediatrician and as a co-owner of the hospital. She is the ex-faculty, Apollo Institute of Medical Science and Research, Jubilee Hill, Hyderabad, ex-consultant, Lotus Children Hospital, Hyderabad, ex-consultant, Mamta Hospital, Hyderabad, ex-secretary, JAP, Assam branch. It is really an honor to have you, ma'am. And thank you so much for sparing your valuable time. We know that you are super busy, but again, you said yes for staying in the program on the program here. Thank you, ma'am. Ma'am, as I have mentioned before, like there is an increased surge in the number of cases in the infective rate of children's comparing from last year to this year. And take a brief, if we take a rough statistics of the numbers, say in a state of Maharashtra, last year in an expand of 30 days, there was almost a case of 50,000 reported for youngsters less than 17 years. But this year, in a span of 15 days, say in April, there was a difference of almost 10,000 cases, ma'am. So, ma'am, according to you, what could be the reason for such a rise? And also, would like to know your experiences with your children during this pandemic. Again, I would also like to know your views on the vaccinations which is happening right now. We know that the vaccinations happening right now is for the adults who are more than 18 years, and for children less than 17 years, it is not yet a vaccination. Ma'am, how important is it for the children's the vaccination? And in the meantime, what would you advise the parents about the care and the precautions the parents or the mother should take for the children to prevent them from this COVID time and the pandemic, ma'am?
Hello, good evening. This is very difficult situation going on. Last year, though we were thinking about pandemic, actually we have not experienced much.
Sorry,
Can you hear
sorry
me?
to disturb you. Yeah, your this thing is not visible. The video is not on.
Hello?
Yeah, ma'am. Your video is not on, ma'am.
Then I'll put it on my mobile. Okay, hold on.
Yeah, you can continue.
Sorry, I'll just try with my because it is laptop might not be okay.
So, in the meantime, since Dr. Nivedita is joining, we can share the
Can you
yeah,
hear me
yeah,
now?
ma'am. Yeah, it's visible.
Yes, okay. See, this year we have been experiencing with lots of pediatric cases. Last year there was much, means actually there were hardly any cases. Even though the cases were there, they were very mild and asymptomatic. This year, right now in our hospital, we are having a child 3 months old, 9 months old, and 3 years, and with other problem. Like one autistic child is having a COVID, another with a Down syndrome right now in our hospital. So the children mostly they don't have much problem until unless they have some uh, inborn problem like heart disease or immunity problem or some autism or Down syndrome. Especially, I'm worried about Down syndrome because Down syndrome, as such, they have low immunity. So this year, why it is coming up? The question was to me why we are experiencing more cases. But I think the strain is more virulent this year for India, one thing. And last year there was early lockdown. This time there was not such lockdown in the early part. So people are exposing even the parents and the family member getting infected. So kids are getting infected. These two reasons may be the main cause of getting more pediatric cases. Now the worry and the prediction is that third wave may come and the more of pediatric cases will be involved. So that is a prediction. Hope it is not true, because pediatric they even to check the oxygen, the pulse oximeter are meant for adults. So suppose just now one phone call came to me, the baby is mother and the baby is having COVID at home, father is in hospital and baby is having cough, mother cannot know, she doesn't know how to check the oximeter. I said, don't worry, if your baby is drinking milk normally, behaving normally, the color is normal, breathing is normal, nothing to worry because that home oximeter are meant for adults. So it is baby's fingers or toes are very small. So it is one practical thing I'm thinking we should come up with an oximeter. But don't worry about oximeter. We have to look at the baby's behavior. If he is smiling and playful, I think just keep watching them. That is one thing. And regarding the virulence, though most of the pediatric cases, 95%, I think they recover automatically. They don't suffer much. Only 5% will have some problem. That too, those, as I mentioned earlier, those with some comorbid condition. And one serious condition is coming up is MISC, multisystemic inflammatory syndrome of children. This is like kind of a rare but very serious condition with multi-system infection right from heart to lung everywhere. This is rare, and if anybody is having severe illness, everybody should suspect of MISC. If and then by the time the COVID tests are negative for them, so we have to check the COVID antibody for them. So mostly I don't want to scare you, but I think right home care, right your support, right food, right yoga therapy, right immune booster like good food and immune boosting method will help these children. Only few percent may have a severe problem. I hope I'm correct for that. Any other questions? And regarding vaccination, this vaccine is very new. Means mostly we vaccine the vaccination is common for us, like from polio to tuberculosis, typhoid, chickenpox, everything we give vaccines nowadays. Our pediatric practice is full of vaccines only. But since this vaccine is means done, it's very means very hurried manner. We don't know about the pediatric side effects and especially pregnancy and a pediatric age group. So till now, it is not recommended below 18 years, but some countries, some vaccines have come up. It has recommended from 12 years onwards. But we are waiting for vaccine that should be started as early as few months, as early as possible. Because this vaccine is new and virus is new, nothing, the long-term study is not there. So hope for the best. I don't know when the proper vaccine will come. So anything, any questions?
Ma'am, can you explain more about the care and the precautions the parents can take when the child is have been infected, or like just to protect them from the infections?
The universal precaution like social distancing and hand washing, putting mask is important for adults because they are the mostly they are the carrier. They go out of the house, and young infants usually they don't go out. So even mother is having breast COVID, even a newborn baby. We ask them to continue with breastfeeding because breastfeeding is the best food a baby can get. But then mother should wash her hands properly, proper hand washing, putting mask and at least keeping the distance. The face should be distant from the baby. So no kissing, no too much of cuddling, as much as possible. The baby's face should be and mother's face should be little distant. And breastfeeding is allowed from day one. So we have even delivered mother with COVID, and we keep the baby with the mother. Earlier, the thought was like baby should be keeping away from the mother. Nowadays, no. Means from the beginning, last year also we practiced baby and the mother together. Only we check the baby's COVID test we do after 5 days, and even one baby was positive, but along with breastfeeding, we started giving her just vitamin D and normal, that is a normal procedure. And baby was okay. Till date, the baby is fine. So many babies, means there was thought like the baby should be away from the mother, starting with some other animal milk. That is not a good idea. So the thing is, only adult or any adult touching the baby, hand washing, the hygiene, and the keeping means well ventilated room. So I also request everybody not to put closed door and not to put too much of air condition, because air conditioned room is closed. The virus will circulate. So it is better to keep the window open, sunny room, well sunlight should come in, and this regular hygiene. I think that is the only thing, the hygiene. That's it.
Yeah. Ma'am, just last question, like, ma'am, how is the severity in this second wave? Like in the first wave, it was said that, the severity in the children's are much lesser than that of the adult. And in the second wave, is it the same? Is it just the infective rate increasing? How about the mortality rate or the severity rate, ma'am?
Mortality in children is less even now, but
Just one request. Sorry to. Yeah.
This,
Yeah, you can switch off the one of the thing, ma'am, because your picture is not seen in the Facebook. I think since the laptop and these both are on,
acha,
you can just switch off the other one.
I'm leaving.
Just, yeah, fine. Thank you, ma'am. The voice is not audible. Oh God. And the voice is not audible. Hello. Hello. Yeah, ma'am. Can you hear me? Ma'am, we are not able to hear you. Yeah, now it is connecting to the audio. Yeah.
Yes, right now. Okay.
Sorry, could you repeat the last answer, ma'am, for the viewers?
Okay. But I was telling, compared to last year, this time more cases, number of cases are coming, more severe cases are coming up. But compared to adult, even now in pediatrics, death rate is less. But there is a report of death even in a 3-month-old child. But comparatively, we don't have to get worried or panicky. Comparatively, it is lesser. But we don't want any child dying of COVID. That is why I think the detection is more important, early detection. The cases who are having more problem or death is late detection. So anybody with cough, fever, headache, or loose motion, vomiting, stomach pain, anything, fatigue, or family member having COVID. So you must go for COVID testing as early as possible so that we can monitor these kids or adults frequently and prevent death. So this one thing is detection is more important than going for ICU. So I think early detection helps in going to ICU and of course the universal precaution. Because one more thing, the medicine for adult like remdesivir and all are not exactly recommended. Even the datas are not given for this kids. So we have limited medicine to treat this child apart from giving nurse normal regular support. So I request all, do not get panicky for kids. Only thing, you maintain your universal protocol for COVID and diagnose as early as possible anybody having, so that you can at least keep in contact with some doctors so that any problem we can pick them up and treat accordingly. Am I clear?
Yes, ma'am. Thank you so much, ma'am. It was a privilege to have you today, ma'am.
Okay.
So moving on, I would like to introduce Dr. Kavita, Assistant Physician, Arya Vaidashala, Kottakkal. She graduated from BPSV Ayurveda College, Kottakkal. Ma'am is an active speaker in public seminars and awareness classes, representing Arya Vaidashala and reputed clinician at Ernakulam. She is also an authorized medical attendant for Southern Naval Command, also an MPanel AMA for all central government department. Ma'am has been practicing in the field since 8 years. So, ma'am, like Nivedita, ma'am explained, like, and I would like to tell the audience that please don't panic. If any confusion is there will be guidance available even in our center, and even Nivedita ma'am is there. And ma'am, moving on to you, like we are very glad to have you, ma'am. And we all know that Ayurveda is a time-tested system of medicine, and as a Ayurvedic doctor, what are your experiences during time with the children's? And ma'am, please also share about immunity according to Ayurveda, and what is the role of Ayurveda in increasing immunity?
Very good evening to all. I think I am audible.
Yes.
All the dignitaries over there, very good evening and very warm namaste to all. First of all, I would like to answer your question that I never had any experience with the children, because luckily I think in Kerala the children getting COVID is very less, and maybe adults are coming to our post-COVID clinic, but children fortunately not till the time. And today I am going to explain some of the precautions to be taken care of, and also about the immunity that can improve the children's immunity. So I think I can begin my lecture. We all are going through tough situations that we know, and that this era of seminars rather than webinars rather than seminars, and that is why I am sitting in the center, the southern part of India, interacting with you people in the northeast. Very pleased to have you all, and very happy to share my whatever knowledge I have with you. After the outbreak of pandemic, we were hearing certain new words frequently, like quarantine, mask, sanitizer. Immunity is also such a word that we used to hear a lot. I think 1.5 years before, we were not so much bothered about immunity. But when we realized that prevention is better than cure, all started searching new ways to increase immunity. And there comes the significance of Ayurveda. Ayurveda is the natural way and traditional way of living and healing. I am here as a representative of Kottakkal Ayurveda, an institution which is started in 1902. Our founder, Vaidyaratnam P.S. Warrior, his foresight and also his social commitment is still being followed by the institution. We have so many 26 branches around India, and so many numerous authorized dealers also. I think the branch which is close to you will be at Kolkata. Our institution propagate, promote and practice Ayurveda. Post-COVID clinics are there in all the branches. And together with the Ministry of Ayush, we started making Ayush Goda Churna. And under the manufacturing, we are trying to, in the efforts of manufacturing Ayush 64. I think the first session, Ramesh sir might have explained it about the particular Ayurveda last Sunday. Today's my topic is positive health for children during COVID. I'm dealing with the topic called Balopacharanya. Balopacharanya means the pediatric care in Ayurveda. Good habits we should learn in the childhood. That will be throughout the life, and till the end of the life, that all the good habits will stay with us. And the habits that we learn in the childhood, that provides a good base in the future life to create a healthy and responsible citizen. According to Ayurveda, there are 3 types of immunities: Sahajam, Kalajam, and Yuktigridam. This Sahaja immunity is the natural immunity that we get through our birth. That is the natural immunity that is gained naturally. We can maintain and we can nurture our natural immunity by simple practices in the lifestyle, good dietary habit, proper sleep, and also positive attitude. Ayurveda teaches dinacharya and vidusharya and so many good things to have a healthy body, to have all the swasthas. So coming to my topic, Balobhacharaneyam, that means that comes under Kaumara Vidya, it is second anga of Ayurveda among the eight. It deals with the regimen to be followed, including food, care of the baby, and instruction for the mother, or in any circumstances, if the mother is not able to take care of the baby, someone else has to be appointed. That is, we call it Dhatri, a wet nurse. Instruction for the Dhatri. Then the remedial measures in case breast milk get vitiated by doshas, and all the cure for the ailments of the baby. Overall, in sum up, overall, all the ways to bring up a child happily and healthily. Ayurveda advocates that baby's health should be considered even before birth, even before the time of conception. Before the time of conception, the couple should be mentally and physically tuned to having wholesome child. There are certain do's and do nots for the parents, especially for the mother. Mother should have nutritious food, proper sleep, pleasant family atmosphere, and she should avoid all the evil thought, physical and mental excessive strains. That all she should avoid. Couple is prepared to have a positive approach towards the child when he or she joins the family as a new member. So parents' behavior towards the child exert direct influence on the development of child's mind. As Charagasarya says, even the food that the mother is taking is having an effect on the mother. For example, if mother is taking excessive sweet food, there is a chance that the child is prone to get diabetes. Or if she is taking sour food, there is a chance that this child will have skin diseases like that. So the mother's food, mother's mental status, everything matters a lot. Once the child is born, then Jada karmas are done. The baby is anointed with the mix of ghee and rock salt. Then Balatayam is applied and it is wiped out cleanly and smoothly. Then the umbilical cord is cut 4 angulas from the umbilicus, that is after tying a knot, and Kushtatayam is applied. Then comes the bathing of the baby, that is in a warm water. The water is warmed by putting red hot rod of silver or gold into it. Or in other cases, Chiri Vriksha Kashaya can also be used. The Chiri Vrikshas means the Raksha, Udumbara, Ashwatha and Nedroda. I think Ayurvedic people might be knowing those things. After bathing, prashas are given. During the neonatal period, the rhythm of breathing, sleeping, feeding, and elimination of urges are established. So prashas are Swarnam, Vacha, Brahmi, Pushtam, and Abhaya. They are mixed with ghee and honey. Ghee just half the quantity of honey, and that is given in very small quantity. The quantity that we can take by joining our 3 fingers, thumb, index and middle fingers, just small quantity. That is given as prashas. Another prasha is gold and amla, the gooseberry powder and gold together with ghee and honey, as I stated above. That ghee just half the quantity of honey. That can also be given after bathing. This will increase the lifespan, that is the eyes of the baby, the intellectual and grasping power, the complexion and memory. Breast milk is always the ideal food for baby. First secreted colostrum helps to build immunity. Breast milk is available at correct temperature without contamination and it is easily digestible. That we all know. Up to 6 months, breast milk meets all the nutritional needs of the baby. Breastfeeding also creates a strong mental and emotional bond between the mother and the baby. The child senses security and attachment with the mother is strengthened through this. Nowadays, when we are using more of electronic gadgets and mobile phones while feeding, that is not at all advisable because that breeding become a passive process, and the so-called strengthening of bonding is not happening there. Ayurveda also demands certain qualities for the lactating mother, even if it is the mother or the Dhatri, as I said earlier. She should, if it is Dhatri, she should not have any contagious diseases. She should be affectionate to the child and should eat food that promote lactation, that is nutrition also. The milk decoctions of Shadagiri, Vidari and Musli that can improve the lactation. Particularly Ayurvedic products like Stanya Janana Rasayanam and lactocode granules, those are also help to increase breast milk, but to be taken with the expert opinion only. The quantity and quality of breast milk, that is very much affected by the food, the mental status of the mother, anger, sadness, anxiety, depression, fear, and fasting. Those all are having adverse effect on lactation. So we should avoid the spicy things, the so-called tikka and katta things that the mother should avoid. From the 6th month onwards, the child is introduced to other food that is known as weaning. Semi-solid food and solid food can be given. Ayurveda says once the teeth are erupted, then the child can introduce to other foods. Jada Dashanam, that is means teeth comes, the child can have other food also. That food should be laku and brahma, that is easily digestible and at the same time nutritious to the child. In our case, we use rice, vegetables, and fruits that are the first food to be introduced to the child. Then that is all in very small quantity, very less quantity, and followed by pulses and leafy vegetables. Ghee is a good thing, the best thing to introduce to child in very small quantity, because Ayurveda say that ghee improves the intelligence and at the same time increase the digestive power. Smoothie, meda, agni, all this can be improved by a ghee. Buttermilk, soup, that all can be introduced at the first stage. By the age of 1, the child should be able to digest whatever an adult is taking. Now we have gone through the food. Care of the baby is also equally important as food, because the mental, intellectual, and character formation is decided by the care that is given in the earlier years. Child should never be left alone in solitude, dark room, during thunderstorm, near fire or water. Child should be handled softly and smoothly. He or she should not be awakened suddenly. Never attempt to use the key of fear to feed or to pacify the child. Such practices reinforce fright in the child's mind, and that may later prove harmful in the normal mental development. So always behave affectionately and never hurt the child by any means. Nowadays, when attention deficit hyperactivity, autism are more in our society, the parents should be very much aware of these points. Overuse of mobiles and other electronic gadgets can lead to such conditions, because when we are giving the mobile to a child who is less than 2 years of age, we will be giving them the mobile for them to make calm or to feed them, or for we can do our work comfortably. That child is busy with the mobile, but that has an adverse effect in the long run. That will prove very harmful to the child. I remember a small boy, 2.5-year-old boy, who came to our pediatric OP, who was a son of parents who were very busy in UK. They are Indians but settled in UK. The child, when came to the room, he lives in a world of his own. When we call him by the name, he just turned the face for a fraction of a second, and then he again returned to his own world. He was singing a song that Dora, 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 because Dora was his character around him, and also talking about a golden duck. That is also all the cartoon characters around him, and whatever we human beings he was not able to see, he was not able to respond. So in such cases, this care should be the mental development should be taken care of. Then Kashyapa Samhita, that is a famous book of pediatrics in Ayurveda. that details the systemic way of bringing up a child. Annaprasana, that as I told, meaning introduction of solid food, then Upaveshana, that is the introduction of new toys, and Karna Vedana, that is piercing of ear. All these functions are celebrated as ceremonial function that helps to expose the child to the social life and to respond to the society in positive manner. Arogya Kalpaduma, that is another pediatric test, describes some immunomodulatory medicines. Those are known as Prakara Yogas. This Prakara, the word means wall. Just the way a wall protects a house from all the outside calamities, this Prakara Yoga protect our body from all those diseases. These are the medicine to be served for 7 days continuously from the very next day of the birth, and then after 15 days or after 1 month, after 12 years, these Prakara Yogas can be continued, and that has best effect on the immunity. But the thing is that all these medicine has to be taken only with the expert consultation. Now coming to the diseases, Balya is the Kapha Kala. Kapha dosha will be more predominant, and the child is eating more sweet food like milk, ghee, everything is sweet. So Kapha will be more dominant, and the diseases are more of Kabaja. Other than that, respiratory, digestive, and also skin diseases are seen in children. We can sum up 3 reasons for these diseases. One is malnutrition and infection. The second is unhygienic surroundings. The third is the lack of proper care for the child. The diseases are treated according to the symptoms. Since the child cannot express anything verbally, there are limitations to the communication. So we assume that the body part where the child touches again and again, that is the place where he or she has pain. Or if someone else touches the child, at that part, if he or she cries, that is the side where the child has pain. In this way, we can assume how what is the type of pain and where is the site of pain. These diseases are also treated with mild and small doses of medicine. That is Saumya Avishadaje. That is the word used in Ashtanga Hridaya. At the time of milk teeth eruption, children might have fever, vomiting, diarrhea. These all problems can be treated with a medicine called Rajanyadi Churna that is effective in almost all type of pediatric cases. Particularly Ayurvedishala has that product, but to be taken with an expert opinion only. Gopi Chandranadi Guliga, Aravindasamam, Rajanyadi Churnam, Nustarishtam, Bala Amudam, Mukka Mukkadi Guliga. These are the common used pediatric, some of the commonly used pediatric formulations, but all to be taken with doctor's consultation only. Recurrent respiratory infection, that is very common at that age, that also can be treated with our immunobooster syrup for children, that is Indugandhamardam syrup. That is going to be very effective if you take 5 or 10 ml of this syrup according to the age for 3 months. The frequency of and this also the severity of the infection has come down very much. Ayurveda describes another group of diseases, that is Valagraha. These diseases continuously crying and fever, that are the symptoms. I don't think now it is very common in our society, but that can also be treated with medicine that will improve the digestive power and also pacifies the mind. Being a clinician, the commonly heard question in OP is that, is there any medicines to boost the IQ of the child? We have so many medicine, but Saraswara is one of the best medicine that has proven very effective in such cases. Genicot syrup, Brahmi caps, all these medicines are effective in such cases. Now I would like to share some of the Kerala practices with you. The first thing is that at the time of conception, 3rd month of conception, the mother is given Kalyana Krida. The 3rd month is a time when baby recognizes the emotions and also mana or chitta is being established. So Kalyana Kridam helps to improve the cognitive and intellectual properties of the baby. That is for Kerala practice, I think. And the second is the use of Uramaranda. That also certain Ayurvedic drugs like gold, vacha, chandanam, rudraksham, triphala, and yashti madhu, that is in very small quantities mixed with brahmi surasa or breast milk, and that can be given from the 28-day onwards till 6 months or even more. That is very effective in proper speech, good memory, and improve the brain capacity of the baby. In Kerala, children are practiced abhinga, that is the application of oil both on head and body. That will improve the muscle tone, the strength of the bones, and also improve the color, texture, and glow of the skin. Alpamaradi Keratailam or Lakshadi Keratailam is very commonly used. But if there is any skin issues or itching, Eladi Keratailam and Chambratyadi can also be used. But virgin coconut oil is the most commonly used oil in our places. Depending upon the climatic condition, the geography of the place, maybe the different parts of India. So the cases that I deal in my OP may be totally different from yours. So I don't know how much um, I could meet your expectation. But anyhow, these are some of the ways, some of the Ayurvedic ways to bring a child up scientifically. Now coming to the reality is that the child is sitting at home. School is in a new normal mode, that is a virtual mode, online mode. So the one who used to play at playgrounds, they used to mingle with their friends from different backgrounds. Now all those chances the child has lost, and he or she is sitting in front of a TV or a PC. So the child from the 5 to 15 year or elder than that, they will have the energy inside them. They have to utilize it in some way or the other. So what they are doing is they are shifting their playground to online games. Online addiction is so dangerous that a few days back, a 13-year-old boy who committed suicide actually in Kerala. So the addiction, the pandemic stress, the anxiety, the depression, sleep disorders, those are very prevalent in all the age group now. Government has came up with some call centers, mind relaxing techniques, and all. There are counseling centers we can call. The child can call and share their anxieties, their feelings with the center. I think even CBSE has recently launched a site that those CBSE those for life for the children to share their anxiety. But not as a doctor, as a parent, as a friend, I have two simple ways to suggest to the parents. One is that you may be busy, you may be very busy with your work, with your home, work from home, and so on. But still, find some time, that is quality time for the child, because so that they feel that they have someone to open up, they have someone to share. At the same time, be a role model by reducing your gadget time. Then the child also won't be so much addicted to gadgets. Divert his energy to something creative, that is like painting, drawing, then reading, that he is interested in. The second thing is that each child is unique. So they might have their areas of interest. Don't put the burden of your expectation on him. He might have his areas of interest. Encourage him, support him. That is the best that we can do as parents. This bad time to shall pass. Before binding up, I thank you all. Thank you all for the patient listening. I'm very happy that I could interact with you people. Never got a chance if it is in a seminar, but through the webinar, it happened. And I also thank my senior Dr. T.M. Univision sir, because his encouragement that you can do, that was the word that brought me here. I think I have given a big picture, or I don't know whether it is clear to you or not, but I try to cover all the areas within the 20 minutes of time. I believe you could get a vague picture of Ayurveda, or how to bring up a child from Ayurveda. And if you learn something of Balopacharaniam from this talk, I'm happy. My pleasure. Thank you. Thank you.
Thank you, ma'am. It was very clear, and thank you for the wonderful advice. and saying that taking care of the pregnant mother while we are looking for the care of the child is very important. And as a naturopathy doctor myself and being diet a major part in this, I have been advising my patient that having a wholesome food, it's very important. And I would like to add some points that, in developing immunity as such, regarding the kids, I would say that foods which are rich in zinc, there are lots of researcher studies which are done in zinc since very long in its role of immunity. And then we have food rich in nitrate oxide, and we know that nitric oxide in the body helps in preventing the inflammations or spreading of infections in the body. So even parents could add a few attractive juices like ABC juices, which will also provide nitrate and also zinc in the diet. Thank you, ma'am. And moving on, I would like to introduce Dr. Amit Mishra, sir. Sir is a medical graduate and a PhD yoga scholar. Sir has an experience of 20 years in the field of Ayurveda, Panchakarma, and yoga. He has completed the central government project for yoga and diabetes as SRF. Sir also did a paper presentation on breast cancer and yoga at Harvard Medical School, Boston. Sir is now engaged in an year-long project in diabetes and yoga. Sir, in your such a long period of your practices, you might have come across experiences with the children as a Ayurvedic and yoga practitioner. And sir, you were also invited at the Health University of Guadalajara, Mexico, for a special yoga event. Now that the children are forced to stay at home, like Kavita ma'am mentioned that they are forced to stay at home, they have more screen time, they cannot, in order to expend their energy, express their energy, they have to, be indulged in the online game also, sir. During this time, what will be your advice to the parents and the children in order to keep them active, and what practices can you advise to them and the children? And are there any programs that we or Dirghayuk Enterprises or the Vivekananda Health Global provides for the children, sir?
Thank you, Dr. Kavita. That was a wonderful the thoughts which you have expressed. And I'm so happy that I, also being a Ayurveda physician, has really sailed through what we have learned in our school, college days. And you have been implementing that into your day-to-day practices. So wonderful presentation and good knowledge sharing, ma'am. So all the regards to you. We are also happy to share that Vivekanand Health Global, which is based in Guwahati, is now the official dealer for Ayurveda Kottakkal. So people who are in the vicinity of Guwahati will be able to get the benefits of all the medicines which you have suggested in Guwahati itself. Dr. Nivedita ma'am has given a very good light on the current situation. So taking this ahead, my role today will be about the yoga practices which can be taken up for the for the children's. So I believe that many of the parents have joined us today. So I will be doing a screen sharing whereby I will be trying to show few of the practices which can be taken up by the children's. So yeah, my first slide be visible. I'd like to check.
It's visible, sir.
Okay, the first slide is visible. Okay, I'll just do it once again. Fantastic. Just trying to go back to the slide one. Okay. So, in fact, yoga has been very helpful not only in the cases of asthma or the breathing disorder. This has also been effective in a lot of other cases like abdominal pain, obesity. Small children's gaining weight is now very common. So in the obesity also we have seen a very beautiful results because of the yoga, because of the dynamic practices. As Dr. Kavita ma'am was also saying, now most of the children are there online. So initially we were asking them not to use the gadgets, but the time has come when now they will be more on the gadgets. So it may be either the laptops or it may be the mobiles. And this also adds to a lot of strain on the eyes because of the blue light emissions. And there is a lot of anxiety because children are not able to go out, and in these cases also, we have found yoga to be very effective. Children's, they have the problems with the memory. They are not able to concentrate. They are not able to focus or not recall what they have learned. So in these cases also, we have found the yoga to be very effective. Uh, if we see as far as the learning disorders is concerned, or there are some kind of a attention deficit problems, like the children are trying to have the attention of the parents and again. And in these cases also, yoga has helped a lot. And very happy to share that S. Vyasa, Swami Vivekananda Yoga Anusandhan Samsthan, which has been working in this field for last 40 years with the support of all the clinical trials. We have been able to produce so many number of papers where they have shown that the research and yoga, how it can be integrated. So it is an integration of the tradition with the modern, with the support of the research. Mm. If we see the changes which has been happening in the adolescence, and because of which there are a lot of stress which the children have, or maybe because of the peer pressure. So even these cases, we have arranged the PDC, personality development camps, which is a camps for 10 days, and where the children stay with us, and then they have been given various practices, various activities, so that they are able to come out of this peer pressure, and then they are able to have more clarity on this. So it is a wonderful activities of PDC, whereby other than the routine studies, they have been given the activities which they enjoy and learn and able to transform themselves also. So moving on to the current scenario of the respiratory problems which we have been seeing. So if we see the cases of asthma, there are two major things which has been happening. One is the bronchospasms. So why is the bronchospasms? The bronchospasms means the flow of the air is been blocked. It can be because of many reasons. And the second condition, what we see is the sputum getting thicker. And because of the sputum getting thicker, the airway is not that free. And because the airway is not that free, they have the respiratory problems. And then they had to move on to the other options which are available. So what we have been doing is have been found a very beautiful results in these cases of asthma, whether it is in the children or it is in the grown-up. So I'll brief up of the yoga practices which has been given in this respiratory problems, like in the current scenario also. So we divide that into 4 stages. One is the respiratory training. Second is the postural training. The third is the relaxation training, and fourth is the concentration training. So I'll try to explain each of these and how these work around. So the first respiratory training is about the breathing, the pranayama, which we have so much heard of. So it may be the anulom vilom breathing, or there are some breathing exercises. It's a beautiful combination where we have the exercises blended with the inhalation and exhalations. So suppose if they are doing the hands in out practice, they will be also doing the exercise with inhalation and exhalation. So in this way, there is a flow of the prana, the flow of the energy along with the practices or with the exercise. And this has found to be very effective. The second is the asanas. It involves all the physical postures. So it may be doing the Surya Namaskar, or it may be doing the exercise in the sleeping position, standing or sitting position. So different asanas are there. So what we have done is to add the fun to the child. We have added few of the practices like how the cobra pose is there, what happens in cobra pose, or how the elephant moves its tusk. So we have tried to give that, so there is a physical activities and there is fun. So that children able to continue, because the continuity is will be giving the success. I will be showing few of the slides how the practices have been taken up. Then we have the relaxation training, whereby they will be getting tired. So we want to relax them physically and mentally. And then we move on to the meditation. It's very difficult to make a children sit in a particular spot. But we have improved upon this and came out with a small modules for 5 minutes, 10 minutes. We are able to concentrate. They have to be on certain thoughts, and so that they will be able to improve their creative skills and they will be stable to the given time. So I'll move on to the practices, which will be of the interest to the parents also. So we have a tiger breath. So what you see here is the movement of the spine. So what we do is with inhalation, they will be going up, and exhalation, they go down. So this can be done in the form of a fun. So what they do is that they will be taking the breath in, and when they exhale out, they will be doing the lion roar. So they take their tongue out, something like fun. So what happens is they enjoy these practices because they will be able to resemble themselves to the lion, and they do the breathing practices also. In the same way, we have a breathing practices which we term as Brahmari. In this, there is a humming sound which has been created by the throat. So all the children will be sitting together, and then we tell them, you close your eyes and you imagine the honeybee coming down to your room, and then you create that humming sound. So everybody will be doing. Mm. So there is a sync of all the children together, and then they enjoy that because they will be also getting that vibrations in their head, in their ears, in their body, and then that the sound is also been created. So these kind of practices with little bit of fun into it, we have been taking. The second is like a camel ride. So we say now let's go for a camel ride. If you are going to the beaches, you see a lot of camels there. So we'll ask them to sit, what you can see in the picture, and then we'll try them to keep their spine straight. And after that, you as you inhale, exhale, you can bend forward. So it's something like a camel bump. Inhale and bump. So they enjoy these movements because it adds to the breathing. It brings about the flexibility of the spine, which means there will be strengthening of the muscles around the spine, and this will also help to improve the digestion. So they have now a ride on the bumpy camel, and which they will remember. So this way we add to the other practices. Moving on to cobra pose. So if we have children, usually children are afraid of cobra, but then specifically in these conditions, when children are suffering because of the breathing problems, or we don't want them to get into the breathing problem, we say, let's do the cobra pose. How to do that? They will be lying or prone on their chest with the hands support. They will slowly try to come up. So we say, do you remember how the snake makes that sound? So from the bottom line, they slowly come up, inhalation, and then they do hiss. Everybody doing together, and they enjoy into the fun. By this, there will be the upper lobe and the middle lobe of the lung is also involved. The breathing has also been happening. What happens is most of the time, whenever we are breathing to the lower lobes. The upper lobes are not getting involved. So when you stretch yourself, so it is a rule of opposites. When you study, you are bending forward and breathing. But when you are doing the back bending, the stiffness of the spine is also taken care of. The upper and the middle lobe also become functional. So which means the chances of having the respiratory problems is also reduced. And if they can, we ask them to fold their feet. So we say now it is your tail. It's a tail of the cobra. And then it enjoys, it adds the fun to these small children. Then we ask them, do you remember the train which goes from place to place? So let's imagine that you are in a jungle and now you have to drive that train. So they will be moving their hands forward and backward with the breathing practices. So what happens is there is a movement in the shoulders, in the elbows, in the fist, along with the breathing. And then when they move this, we said you do it for 30 seconds or 1 minute till you reach your destination. So they can do it in a circle also, whereby they will be punching their hands and they reach out to the small activities. The movements of the legs, the shoulders, and everything, coordination is also there. So there is physical activities with mental coordination. We have one more way whereby we do the air walk. The air walk, they can lie down, they will be lifting their left leg and their right hand. So they have to be alert with the coordination, so mental involvement plus physical activities, and they can do it with breathing. Inhale, exhale. So it is a fun. So the synchronization, the main thing in all the practices, bottom line is exercise with the breathing. So these both should work together. And this is what we have tried to do. We have been doing this in the form of PDC camps, also personality development camp. There is one more practice which can be enjoyed. This we have been taking at our Vivekanand Health Global in Guwahati also in the form of development camps. We have the online sessions also going on now. Since children are at home, they can get enrolled into these PDC activities also. So what we do in the birthday candle program is they will be sitting on the floor, they raise their hands and they blow out, some as if they are blowing the candle. So they raise their hands and then they blow. So what happens is your lungs are getting involved, plus the hand movements are there. So synchronization with that. They inhale through the nose and blow through the mouth. So the breathing is happening in both the ways, the nasal and the mouth breathing. So this is how the practices has been taken up. Now, after a certain practices, we have the Surya Namaskar also, which we ask them to do. And once they are getting tired, we ask them that they can lie down in supine and they can just imagine themselves having lying down on a sand. They are in the beach now. And when they inhale and they exhale, what they can do is they can sink as if the wave is touching them and the waves is moving away. So inhale and exhale, they can have that sink. Now they have that awareness. And we ask them to spread their hands out so that there are small seeds on your hands. The birds are going to come and take that seeds. You have to keep your hands open so that the birds will be able to feed on them. So they are more aware of their hand movement also. And in this way, they are able to have the sync with their breathing and with the physical body also. So this is a type of a relaxation which they do. And in this way, they will be able to learn about the relaxation, how the relaxation happens. Then we have a beautiful meditation session which we take for the children. What happens in this meditation? We ask them to sit with a cross leg and then tell them to recollect all the things which they don't want to do. They don't want to study. They don't want to keep their neck and spine straight. They don't want to eat green vegetables. So we say, okay, fine. So every time you try to remember that thought, say no. No to vegetables, no to study, no to early retirement at the bedtime. Mother is always behind you, says go to sleep, you says no. So you just recollect the thoughts and say no, no. So what happens is, end of the session, there will be so many notes. They didn't realize that with this, they have been also breathing and doing the exhalations. Now we say, because you have thrown out all out the negatives, the no's. So now all the yes have come in. So now you, when you go home, you have to have yes to the vegetables, yes to early retirements, yes to your studies, because you have given up all the negative thoughts here. So in this way, we are able to have a small practice for these children in the form of a meditation. If the children are grown up and if they really have the problem of cold, cough, tonsil, bronchitis, then we ask them to do the Anuloma Viloma breathing practices. We have a beautiful practice of the chair breathing. What we do is we ask them to sit, as you can see in the picture. They will be spreading their hands and then they raise their head up, exhaling, they slowly bend forward. So they will be doing in three ways. One, just inhale and bend. Second, with the breathing. Third, they will be doing with the chanting, like so when they do the chanting, it has more kind of a relaxation. Plus, when you chant akara, there is a complete exhalation, so which means you will be getting more inhalation. So this is very helpful for the people who are having the difficulty in breathing. And this has worked very well. I'm very happy to share that in the British Medical Journal in 1985, this paper was the first international paper which was been published from S. Vyasa. Today we have thousands of papers which has been published. Air breathing forms to be a very major thing among all the children. And now, before the winding up my section, I'll take you to the beautiful pictures of the Vivekanand Thal Global Guwahati, which is spread over 3,500 square feet. And we have the facilities. So this is the sitting area, the pharmacy. And then this is the 8 beautiful rooms, therapy rooms, which we have, whereby we can have 8 different therapies going on, the naturopathy, the yoga, the Ayurveda. It's an integrative center. Plus, we have a beautiful yoga room also. And then we have the consulting rooms for each of these doctors from Ayurveda, yoga, and naturopathy. And this is a Dirghayu COVID Kavach, which we have come out, which I was talking about in the starting. So which we have in 3 forms. For the prevention, people who are healthy and they want to remain so. Second, people who are in isolation, who are having mild problems. And the third set is the people who have recovered from the COVID, post-COVID, but they may be having the breathing problem or they may be having the body pain. So we give them the online support in the form of yoga practices. The Ayurveda medicines, yes, we are very happy to have Ayurveda Shala Kottakkal, and now we are the authorized dealer in Guwahati. And then we blend it with the naturopath. So we are able to give them the guidance of what to eat and what not to eat. So this is what is our COVID, Dirghayu COVID Kavach. This we are now running very successfully. We are happy that Vijay Gupta ji is also here, who after my talk will be able to, I'll request him if he can share his thoughts about this program. This is the camps which we have been taking for the children. The elders and the parents, children are also involved. We had them in the day of International Yoga Day. 12 camps were been organized. And this is the PDC, Personality Development Camp for the children, which we take. as a part of our social projects. We have been doing it in the rural part of the India also. So this is a project at one of the far off places in Kinavli. And this is the end of my session. So thank you everyone for giving the time to me. And over to you, Dr. Khalid.
Thank you, sir, for sharing our viewers the numerous practices and the techniques for the children. Now we have one of our participants, Mr. Vinay Gupta ji from Guwahati, who will be sharing with us his experiences with us and who has gained the benefits from our Dirghayu COVID Coverage, our online support program. I invite you, sir, please share your views and experience with us.
जी आप आपका कैमरा भी ऑन कर सकते हैं if it is convenient for you. जी विजय जी आप यहाँ पर हैं, आप हमें सुन सकते हैं?
जी मैं हूँ। वीडियो जो है वीडियो मेरा आपकी तरफ से ऑफ किया हुआ है।
ओके कोई बात नहीं, मैं होस्ट को रिक्वेस्ट करूंगा कि वीडियो को ऑन करके नहीं शायद वीडियो ऑफ है गुप्ता जी का, ऑन कर दिया जाए।
नाउ इट्स क्लियर, नाउ इट्स ओके।
यस
सुनाई दे रहा है?
जी सर
सुनाई दे रहा है जी।
हाँ सर।
So very good evening to all gentlemen on set of this very educative and awareness virtual sessions, and especially special thanks to Dr. Nivedita Goswami, Dr. Kavita, and Dr. Amit Mishra, and Dr. Terina, Dr. Mamta Mishra also. मैं तो वैसे आई एम नॉट चाइल्ड, मैं 66 ईयर ओल्ड। 26 तारीख को 26 अप्रैल को मैं कोविड पॉजिटिव हुआ और 15 मई को नेगेटिव डिक्लेयर हुआ। तो 20 दिन मैं होम आइसोलेशन में था और इस होम आइसोलेशन में विवेकानंद हेल्थ ग्लोबल गुवाहाटी के तत्वाधान में, मैंने उनके गाइडेंस में डॉक्टर अमित मिश्रा और ममता मिश्रा ने डेली जो मेरी मॉनिटरिंग की, वो निश्चित रूप से एक बहुत ही वेलकमिंग स्टेप है। वैसे एक दो डॉक्टर्स मेरे जीएमसी के भी थे, दूसरे भी थे। मैं अगर वी आर लिविंग इन द एरा ऑफ द कंपटीशन एंड कंपेयर, अगर हम कंपेयर करें तो बहुत ही वंडरफुल जॉब किया और आई एम पर्सनली वेरी थैंकफुल टू द विवेकानंद हेल्थ ग्लोबल गुवाहाटी फॉर दिस। अब मैं कैसे ठीक हुआ? डेली मॉनिटरिंग थी ही, प्राणायाम, योगा, मेडिटेशन और ब्रीथिंग एक्सरसाइज जो बताया गया, आज भी बताया गया और मैंने किया खुद। इनहेल, एक्सेल, हमिंग, अनुलोम विलोम, स्ट्रेचिंग, एक्सपेंशन और इन्वॉल्वमेंट ऑफ द लंग्स आल्सो। और 6 मिनट का वॉक, 6 मिनट्स वॉक जो है वो मेरे लिए बड़ा फायदा था। 6 मिनट वॉक कर करके मैं मॉनिटर करता था कि मेरा जो है सैचुरेशन लेवल क्या था। उसके बाद मेरे को आयुर्वेदिक मेडिसिन दी गई और वो आयुर्वेदिक मेडिसिन मेरे को काफी उससे मेरे को काफी राहत महसूस होती थी, क्योंकि मैं साथ साथ एलोपैथ मेडिसिन भी लेता था, लेकिन मेरे को लगता था कि मैं आयुर्वेदिक मेडिसिन लिए बिना मेरा ठीक नहीं होगा। तो मैं दोनों ही साथ साथ चलाया, लेकिन ज्यादा विश्वास मेरे को आयुर्वेदिक मेडिसिन पे ही हुआ। और मैं एक बात बताना चाहूंगा कि इस जो संघर्ष का जो दिन था 20 डेज, उसके अंदर में प्राणायाम, योगा, मेडिटेशन, ब्रीथिंग एक्सरसाइज के बावजूद एक जो सबसे बड़ी चीज थी वो थी कि मैंने स्पिरिचुअल सॉन्ग्स, मतलब एक पॉजिटिव थॉट्स मैंने एक्सेप्ट किया कि ठीक है कोरोना हुआ है, कोई नहीं, मेरे साथ में विवेकानंद हेल्थ ग्लोबल के लोग हैं, डॉक्टर्स हैं, मैं ठीक हो जाऊंगा। तो एक पॉजिटिव थॉट्स मैंने दिया और एक्सेप्ट द सिचुएशंस, और विद द स्पिरिचुअल सॉन्ग्स मैं नियमित रूप से जो है सोते वक्त और सुबह उठ करके स्पिरिचुअल सॉन्ग्स का आनंद लेता था। और प्रॉपर फूड तो था ही, जैसा कि हमारे आप लोगों ने ग्लोबल विवेकानंद हेल्थ ग्लोबल ने मेरे को जो डाइट सजेस्ट किया था वो डाइट मैंने लिया और इस दौरान मैंने कोई न्यूज़पेपर नहीं पढ़ा, जबकि मैं डेली बिना न्यूज़पेपर के नहीं रहता था। टीवी न्यूज़ मैंने देखा ही नहीं। तो मैं सोचता हूँ कि नेगेटिव चीज़ों से हम बच करके जो पॉजिटिव थॉट क्रिएट किए और प्रॉपर जो गाइडेंस मिला वो बहुत अच्छा लगा। और आज के सेशन में मैं कहना चाहूँगा कि बहुत ही वंडरफुल सेशन था। और योगा फॉर चिल्ड्रन एंड पर्सनल डेवलपमेंट कैंप, उसको एक तरह से गेम का एटमॉस्फेयर देने का जो हमारे डॉक्टर मिश्रा जी ने जो ये अमित मिश्रा जो ये कर रहे हैं, मैं निश्चित रूप से इसको एक सोशल कैंपेन के आधार से लिया जाए, क्योंकि बच्चों के अंदर में योगा और ये मेडिटेशन दोनों ही बड़ा डिफिकल्ट सब्जेक्ट है फॉर द चिल्ड्रेंस, और उसको गेम एटमॉस्फेयर में गेम का वायुमंडल बना के करना मैं सोचता हूँ कि बहुत अच्छा होगा। तो मैं पुनः सभी को धन्यवाद ज्ञापित करता हूँ। आप लोगों से इसी सेशन में मुलाकात हुआ और फ्यूचर भविष्य में भी मिलेंगे। धन्यवाद।
Thank you, sir, for sharing your experiences. I hope आपके experience सुन के ज़्यादा people aware रहे हमारे COVID कवच program के, and then ज़्यादा लोग फायदा मिले. Thank you, sir.
थैंक यू वेरी मच।
हाँ, हमारे पास एक और participants है जो हमारे दीर्घायु कोविड कवच का फायदा मिल चुकी है. मिसेस कल्पना सिंह फ्रॉम मुंबई. मैम, मैं आपको इनवाइट करती हूँ ज्वाइन करने के लिए. आपका एक्सपीरियंस शेयर कीजिए.
Yeah, thank you so much. Thank you so much, doctor. Thank you so much, Amit sir, Mamta ma'am, to give me this opportunity to share my experiences with you all. In last month, like whole April was a very traumatic month for me, as my whole family was positive. I have my 8 years daughter. She was also COVID positive, but with the God grace, she was kind of asymptomatic. For a day, she got a bit fever. Um, so I just gave her paracetamol and just a single dose. I gave her proper rest, and within few hours she was fine. Yeah, but she lost the smell sense and taste sense too. And but she was totally active, so I was quite fine that okay, she is fine. I was infected with the mild symptoms, as I was having backache, but that backache was very bad. uh, uh, we both were like okay कि ठीक है घर पे आइसोलेशन में ही रहना है, but my husband's condition was getting severe day by day, as on the day one his lungs was involved by 10% only. But on the seventh day, when his saturation fallen down by 96 to the whole day the saturation was 99, 98, but in the night after 8 it was falling down, and in the midnight 12 o'clock it was kind of 88 and 87. So and he was breathless, so we need a oxygen bed immediately. I ran away to the hospital and I admitted him, but slowly his condition was getting worse. So in the next day when we scanned him, his infection was increased till 75 to 80%. So it was very crucial time for me, and we gave the remdesivir and whole procedure is done, and now we are thankfully we are at home safe and healthy now. After my husband's release, uh, I got a very nice uh, preventive suggestions and post-COVID suggestions from Mamta ma'am and Amit sir, the medications also. So it was very helpful journey with Mamta ma'am and Amit sir in the whole journey, because they were guiding me since day one. Mamta ma'am was with my daughter in the midnight when I was running in the hospital, as she is 8 years old and she was all alone at home. So thank you so much, ma'am and sir. You were just behind me like my elder brother and my elder sister. Thank you so much.
Vijayji and Kalpanaji, it's almost a part of a big family, and
Yeah, true, very true.
we always have the to be fortunate enough that we can be of certain help to the other family members.
Yes,
Is
yes.
nothing big which we.
Yes, I just felt that we are family, of course. Indeed, very true.
Thank you, Vijayji. Thank you,
Yeah,
Kalpanaji,
yeah.
for sharing your thoughts.
Thank you. Thank you so much.
Thank you. Thanks a lot.
Over to you, Dr. Tarina.
Sir, we have a question coming from one of the FB viewer. I guess we have time for the questions now. So the question goes, what special medicine, preventive medicine should be given to both mother and child as per Ayurveda? Uh, I think Dr. Kavita ma'am should take the question for us.
We have three special medicine that has proven very much effective for COVID. Indukandam Kodam tab. That is a tablet that to morning to evening. But all this medication that I am saying is general. You have to consult an Ayurvedic doctor in person. Then only they depend upon the age, upon the time, the digestive power, and your what type of body you have. All that decides which medicine. But Indugandam is a Indugandam Kashaya Kodam tab. That is a tablet that has proven to be very effective. Then Vilyadi Guliga, that is one tablet morning and one tablet night after food is also very effective. And Mukka Mukkadugadi Guliga, that is also fine, very effective. The children can have Indukandam syrup, that is the same formulation as Indugandam Padam tab, that can be given to children, but mothers can have the other three medicine which I have mentioned.
Thank you, ma'am. Like ma'am said, the medicines ma'am has said is in general, and if a detailed consultation is needed for any specific medications. So I think we have come to the end of our session. Lastly, I would like to extend my hearty gratitude to all the respected dignitaries present today. Dr. Nivedita Goswami, thank you, ma'am. Dr. Kavita, ma'am, thank you, ma'am, for joining us. And Dr. Amit Mishra, thank you, sir, for joining us. I also would like to extend my thanks to our Vivekananda Health Global Guwahati team for organizing this session in this wonderful platform. And thank you all the audience and our participants who have shared their experiences with us today and making the session complete today. Thank you all. So let's now end the session by chanting Shanti Mantra. Join your palm in front of your chest. हम शांति मंत्र हम साथ में chant करेंगे.
Just a sweet reminder that next Sunday again we are going to be there at the same time, 6 p.m. Sunday, with a new topic to add to the knowledge series of this integrative.
Let's chant the prayer. Om Sarve Bhavantu Sukhinah Sarve Santu Niramaya Sarve Bhadrani Pashyantu Ma Kaschit Dukha Vave Om Shanti Shanti Shanti. Thank you all.